Health Spotlight, presented by Community Health Network.
Well, let's welcome in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. We've seen a lot of big medical news over the past week. I want to start with an overhaul of organ donation rules. You've had a chance to look over those ideas. What stood out to you?
Well, changes include efforts to provide better and more transparent data via real-time dashboards, something I'm a big proponent of, more funding for organ procurement and transplantation, and breaking up the power of the United Network for Organ Sharing, a nonprofit organization that has an exclusive $6.5 million annual contract from the government. UNIS has faced numerous problems, including discarding or damaging too many organs during transit.
So how can these rules help get more organ transplants? We know thousands of potentially usable organs are thrown away each year.
Well, a 2022 report by the National Academy of Medicine called the organ procurement and donation system demonstrably inequitable and found 1 in 5 kidneys that have been donated goes unused. For years, patients have said the system lacks oversight, efficiency, and that it discriminates against people of color. And as an example, Black Americans are 4 times more likely to have kidney failure than whites, but they're much less likely to get on organ donation lists and receive transplants. The White House is hopeful that their changes will encourage competition against UNOS and improve outcomes in a system that has effectively operated as a monopoly for decades.
Okay, we will keep following that as it develops. Here's another story that caught our attention. More children are now dying before ever reaching their 18th birthday. I know you also saw those numbers. Explain what you found is driving that increase.
Well, heartbreaking for me as a dad of 3 teens. For the first time in our recent history, life expectancy for people below the age of 18 is declining, and that's been driven largely by fatal injuries such as shootings, both increases in homicides and a 70% increase in suicides, as well as a spike in drug overdoses. And Drew, on the heels of a mental health crisis that was worsened by our pandemic, researchers found a 20% increase in pediatric mortality from 2019 to 2021, the largest increase in over 50 years. Put another way, if you're a parent of kids under the age of 18 right now, your kids are less likely than you were at their age to reach adulthood.
Wow, that's alarming. What can be done in your mind about those injury-related deaths and specifically for parents at home?
Well, there are definitely things we can do, including normalizing discussions about mental health at home, encouraging your children to talk about their feelings, and paying attention to warning signs for depression. This can include behavioral problems at school, changes in eating or sleeping habits, feelings of sadness or hopelessness, and lack of interest in activities that they previously found fun. And this is important. Make sure you as a parent are maintaining strict control over dangerous substances and items in your home, including prescription opioids and firearms and ammunition.
Well, coming up on that time of year where we can have an opportunity to connect as a family and maybe take a break, I assume that we can get a Surgeon General's approval for enjoying spring break.
Absolutely. You know, making time to unwind with your family is important for your mental health. I would just say to remember to take simple precautions like making sure you're up to date on your vaccines. I'm already hearing people coming back from spring break with COVID. Enjoying adult beverages in moderation, and being aware of your surroundings when you're in a strange place, particularly if you leave the country. And my wife, Lacey, who has melanoma, wanted me to make sure to tell everyone to wear a hat and make sure you use plenty of sunscreen, because you don't want to be thinking about this spring break 20 years from now when you have skin cancer.
Oh, excellently put. Okay, Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams, thanks so much for your time as always.
Thank you.